Improving the quality of life for breast cancer patients, not just prolonging it, is one of the key findings from a new study into patient care. Research by Economist Impact has looked at how New Zealand can improve breast cancer diagnosis and treatment. There's been input from across the health sector, including the Breast Cancer Foundation. They've highlighted a need to focus on quality of life, a collaborative approach between experts and patients, and better access to screening programs. Well, for more on this, we're joined by Emily Tiemann from Economist Impact. Hi there, Emily. Thanks very much for speaking with us tonight. The report found that we have a robust screening program, but that's not how most women find out about their cancer. So why is that?
Yeah, so there's definitely an opportunity to improve the national screening program in New Zealand. The fact that 60% of breast cancers are detected outside of that program through either self-detection or through referral from a doctor tells us that there is a need for better engagement, better advocacy. One idea that is being explored is shifting from self-enrollment to more automatic enrollment in the program. That's something that's already in place in many countries, and it's shown to help with detection. The program could also be expanded to cover a wider age range. Also, ethnicity plays a really big part in New Zealand. So Maori Pacific women tend to be diagnosed at an earlier age and with more advanced cancers. And Maori women have a 60% higher rate of mortality compared to women of European descent. So that's really significant. So screening programs should be designed in a way that accounts for that, to be more targeted to those specific risk factors for specific populations.
What about the recommendation to move beyond mortality and focus on quality of life? What's behind that?
Yeah, so one thing we discuss is rethinking those outcome measures beyond just mortality. So breast cancer is quite a high survival cancer. So one of the conclusions from our report is that we should be moving beyond that mortality and focusing, like you say, on quality of life. Being a high survival doesn't mean it doesn't have a huge burden for patients, both direct, also indirect costs. So the outcome measure of mortality really shouldn't be the only thing that's taken into account when outlining budgets and resources, especially when we're comparing it to other cancers that might have higher mortality.
Okay, the report also said treatment guidelines need to be updated. Why is that?
So New Zealand actually last published guidelines for the management of early breast cancer in 2009. So that's obviously a really long time ago. Cancer is an area where innovation can move quite fast. There's rapid advancement, lots of research. It's really important that patients have access to that most up-to-date treatment based on the evidence. So maybe guidelines might be better suited to be living documents that are frequently revised to incorporate that new data, new research, new evidence. So yeah, one of the conclusions for our report was that New Zealand really needs to aspire to world-class care, improve access to those innovative treatments. Ultimately, that will lead to better outcomes for women diagnosed with breast cancer.
Emily, thanks so much for your time tonight.
Thank you for having me.